When someone's kidneys are failing, doctors need to find a
way or a means that we create an abnormal, what we call circuit, if you will, for a patient so that they may receive dialysis. Well, what's dialysis? Dialysis is an external way that our kidney doctors, or nephrologists, as they're known as, can filter the blood.
Traditionally, doctors create these connections or fistulas by
dissecting out the artery, dissecting out the vein, which is moving it around, and disconnecting the vein and then reconnecting it to the artery.
And recently, Dr. Hochberg heard about a new procedure.
One of the interventional radiology residents who's matched into interventional radiology kind of pushed me and said, hey, there's this new procedure, the data looks good. So she sent me all the data as far as the research regarding it. I said, well, this does look really good.
But the process leading up to this procedure wasn't as simple as talking to the patient and booking an OR. Up until Dr. Hochberg came along, a percutaneous fistula hadn't been performed at Arnot Health before, or any other hospital in the area.
There's a lot of channels you have to go through to get a new procedure, new device. It's not just about, oh, let's do a new procedure. Well, is it safe? What's the efficacy of it? How much does it cost? How much does it cost to the patient? How much does it cost to the hospital? What's the benefit? What's the risk-benefit ratio? So we did all that vetting.
This procedure proved to be less invasive.
We used an ultrasound and a needle puncture, about this big, to go into the vein with a needle, and through that needle we go through the vein into the artery, advance a special wire, just like it sounds, just like a wire, and an IV.
And studies show the percutaneous fistula is less risky for the patient.
The vein has to accept the new flow. It has to be thickened on ultrasound, and it has to have a good volume of blood flowing through it. With a percutaneous fistula, that time to maturation is as little as 30 days.
Compared to the traditional maturation time of 6 to 12 weeks, this procedure has a lower chance of infection, and Dr. Hochberg says patients can get the treatment they need sooner. For Arnot Health, I'm Lexi Cutmore.